land of a billion people. Everything is in abundance in India. Manpower, intellectual capital, opportunities, and cancer. Cancer is the killer we are in danger of forgetting. In 2012, 70,000 women died of breast cancer, and 67,000 died of cervical cancer. And that is just the count of women. With rising population and deteriorating conditions in many parts of the country, cancer is growing to become the #1 killer in India. Consider this: 71% of India's cancer-related deaths happen in the age band of 30 to 69. In other words, the best and the most productive of our country succumb to cancer every year. And 80% of cancer patients consult their doctors only at an advanced stage when recovery is rare. As you can see, from the heartland of India to her extremities, the fear of cancer grips the nation. Changing lifestyle patterns, food choices, and habits all contribute to this dangerous spread. We at Pinnacle Cancer Care India are committed to a cancer-free society.
My name is Dr. Vikas Sayed. I represent the Pinnacle Cancer Centers Group of India. I belong to a family of oncologists. I'd like to say a few words about our commitment to society and the communities. Way back in the 1960s, my grandpa came from the UK. He was well educated in the UK and he came down. He was a personal physician to the Nizam of Hyderabad. Now, along the way, he realized that there is a major problem of cancer burden in India. So he, along with the government of Andhra Pradesh, established the first Regional Cancer Institute in Andhra Pradesh. Today, MNJ Cancer Institute serves almost 18 to 20,000 patients a year. Pinnacle Cancer Center in India, basically we would like to create, we'd like to rather fill up the gap. There is this gap between accessibility of patients to centers of excellence and the availability of technology and centers of excellence which are much further away, mostly in metropolitan cities or tier 2 cities. The gap analysis which we have done proves that more number of patients die because of lack of awareness, lack of accessibility, lack of technology, and lack of comprehensive services which are available to the patient who otherwise would have survived a disease like cancer. Now, Pinnacle Cancer Centers of India will create a network of comprehensive centers across the geographies of the country. We will partner with local institutions and complement these services which otherwise patients would have to travel hundreds of thousands of kilometers away for comprehensive care.
We already have cancer care centers in 3 important cities in India: Chandigarh, Hyderabad, and Trivandrum.
The primary center which we created in 1986 was in Hyderabad. This is called the BB Cancer Institute Research Center. It's a memorial hospital which was created because my grandma died of cancer and we wanted to dedicate that was the first private non-government cancer institute in Hyderabad. That was the first one, way back in 1984. The second project we created was in Trivandrum, which is a partner with the local institution called the KIMS Hospital. So it's a partnership. So our Pinnacle Cancer Centers platform is also in Trivandrum. And the next platform is in Chandigarh, where we have another partner there. And there with Ivy Hospital, we have a very sophisticated advanced technology platform along with medical oncology, surgical oncology, and radiation therapy. So right now we are at about 3 centers and we have another one probably in the next 6 months will come. We look at least, establishing at least 2 to 3 comprehensive facilities every year, and we look at partnering with the local institutions within the state or other states.
We are bringing together the expertise and the experience of our American partners, such as the California Oncology Group, Long Beach Memorial Medical Center, the Orange County Cyberknife and Radiation Oncology Center, the Radiation Oncology Center in San Bernardino, California, and other institutions. By training the Indian cancer specialists and by equipping our Indian centers with the latest in cancer detection and treatment, we plan to forge a strong alliance to fight the menace of cancer.
what we would like to do is, we have two ways of operating. One is building a network of facilities which are comprehensive but cost effective. Now, when we say cost effective, the cost of cancer care is definitely, as we know, it's a huge burden. The technology expensive, the drug molecules are expensive, they all come from outside, nothing is manufactured in India. What we do is we engage with transfer of technology programs with the manufacturers, and for India or Southeast Asia, we try to reduce the price burden on the major technology, which is the brunt. Ultimately, the patient pays for it. So what we do is we engage in technology transfer programs with the manufacturers along with the pharmaceutical manufacturers, and we create the pricing which is more affordable, and probably down the line this would definitely provide more accessibility, because when you serve a larger number of patients, the price values go much lower.
At PCCI, we have our 5 golden Ps. Principles that are enshrined to ensure integration of multidisciplinary services to provide superior outcomes. Passion for care and a commitment to reach out to people. Participation of our shareholders in delivering high-quality cancer care. Pioneering mindset to harness human capital, technology platforms, and skills, and leveraging our 40 years of leadership in US and India. Permeation of vital resources across care centers in India to strengthen our outreach and surveillance programs. We have the values and we have the people to uphold them.
In our experience, basically what has happened is we come from both sides of the spectrum. I belong to the 3rd generation of oncology. I'm a radiation oncologist. I trained at Bangalore's Kidwai Cancer Institute. My grandfather, my mother and father are both oncologists. I have aunts and uncles. So I come from a lineage of specialty oncology family. On the other hand, we also have suffered the disease. My grandmother died of cancer way back in the 70s when my father could not do anything for her. Unfortunately, there was not much development. There was no breakthroughs in the field. So emotionally, we have suffered. I have also lost my aunt to cancer. I have 2 cancer survivors in my family also. So looking at the emotional and the resource side, we realize how difficult it is, the challenge of coping with cancer, the cost factor, the emotional factor, the resources required, not just its intellectual resources, facilities. On the other side, we also have the academics, we also have the professionalism now as a family. So I believe we could connect directly with institutions, with partners, with communities across the country, where we would like to give that extra edge of compassion, concern, care to communities and patients ultimately, and the families who, it's not about technology alone. Anybody can get technology, but it's the connect that's very important. It's not, because patients, when they come, they are so vulnerable, they don't know, they're like lost. What do? We are their hope. We are their pinnacle of hope. So exactly why we feel we'd like to bring all our resources. The patients don't have to worry about that. They should just say, okay, we are in the best environment, in a compassionate, caring environment. These people know what they're doing, and they know what we are also going through. I think that connect is important to reach out to more communities, reach out to more families who are suffering. I think that's what we'd like to message, that we're here and we'd like to come to areas where unfortunately care hasn't reached yet.
PCCI is facing the challenges head on. So what we are really saying is that you are in good, safe, experienced hands. We are PCCI, and we care.